So I'm Louis Parker. I'm a Marie Curie postdoctoral researcher here at the LIB, which is part of ICANN. I use a tool called Computational Fluid Dynamics. So this is really an engineering tool that has been used in a wide range of different applications. What we do is we look at the fluid and we do some very special maths to calculate what the fluid would do under certain conditions. Increasingly, these methods are not just being used to design Formula One cars, but they're being used in a medical setting like the cardiovascular system to understand how blood flows within the heart and what effect this might have for patients with various types of cardiovascular disease. I've been looking at the left atrium. When people have atrial fibrillation, they can have quite an irregular heartbeat, and this affects how the blood flows in their left atrium. These patients are at much higher risk of having a stroke, and it's thought that this is caused by this disturbed blood flow that happens. At the moment, I am looking at patients before and after they have had a catheter ablation to correct their atrial fibrillation. And I'm really interested in understanding what effect ablation has on the flows within the heart and understanding what might potentially lower risk of stroke for these people. Hopefully in the future, we can use some of these computational tools that analyze flow to understand the risk that is posed by atrial fibrillation to people and to help guide treatments to give more precision approaches to the treatment of the disease, whether it be catheter ablation or medical therapy. The success of this project really hinges on collaboration. I come from a mechanical engineering background, but we work with the imaging platform at IHU to really use some of the best imaging and most cutting edge forms of MRI, like 4D flow MRI, as inputs to the model. We also work with doctors at the IHU who give us the crucial clinical insight and background, which gives context to the very scientific, basic science research that we're doing here. The next steps for my project are to take this new computational model that we've developed of the left atrium and to extend it to lots more patients to understand statistically what is happening. To do this, we need to use machine learning to automate a lot of the processes, and we need to use increasingly larger computers to calculate what's happening with the fluid dynamics. From a broader perspective, this work is moving towards patient-specific and personalized medicine. A patient who has atrial fibrillation can have a form of analysis that gives them the best idea of what risk they have of stroke and what benefits they might get from treatment.